So what is the process of getting a dental bridge? First, I would like to do a consultation to evaluate the area in question. I would need to do a comprehensive exam, check how many teeth are missing, the size of the gap, the condition of your teeth next to the gap, if you have natural teeth on either side of the gap, check your gum health. Then we would present a treatment plan. The process itself would take 2 visits, a preparation, shaping of the teeth, sending that scan to a laboratory to fabricate, and then your second appointment, we would cement the bridge and give instructions on how to properly maintain that bridge. So if you have any other questions about the process of getting a dental bridge, please give us a call. We would love to help you.